Hello, my name is Bria Hamlet, and today I will be presenting you Enhancing Cultural Competency, Addressing Key Areas of Concern in Health. To begin, I'd like to define health literacy for you all. Health literacy is the ability to understand and apply basic health information, including preventive care information, hygiene information, instructions for prescriptions, and understanding the human body as a whole. And while health literacy can be applied to several different things, and there are many different principles that contribute to it, for the purpose of this presentation, I'll be focusing pretty exclusively on how language and cultural differences inform health literacy, and how critical it is to encourage patients to ask questions to ensure that they truly understand everything that's going into their care. Some best practices for cultural competency and health literacy are listed here. The first being that there is a pretty large association between language barriers, low health literacy, and poor health outcomes. So the average adult in the United States, so someone who was born and raised here, is about at the 5th grade level. Given that we know this, the average health material is written more for a high school student, maybe even a high school graduate, and so folks who don't speak English as a first language, who maybe didn't finish grade school, are more likely to have poor health outcomes because they cannot interpret health information on their own, and might feel overwhelmed or embarrassed about seeking out assistance from those who might, or engaging further with their medical providers and asking more questions. Cultural differences are also deterrents to pursuing care. So maybe a patient is having a hard time finding a provider that they feel really resonates with them, whether it be from a cultural perspective, maybe they share the same ethnicity, same race, same gender identity, but those sorts of cultural differences can dissuade folks from pursuing care because they just don't believe that their medical provider will understand where they're coming from, their perspectives, and their unique understanding of the world and health care. They also might feel that they'll be judged if they are a minority or a marginalized community moving into a space where they're, one, not very health literate, and then two, none of their providers look like them. And thirdly, it's really important to understand that navigating healthcare is just as important as understanding health needs, but it may be more challenging. So in order to even access healthcare, you have to know how to navigate it, and that plays into health literacy. So if you're unable to understand how to navigate the healthcare system, once you find out that maybe you do need to pursue medical care, you might feel intimidated or overwhelmed if you can't understand cost, if you can't understand care and severity of illness, a lot of different things. And so these all need to be taken into account when interacting with patients with low or poor health literacy. Motivational interviewing and health literacy, this is another best practice that I would recommend when working with patients who are low, who have low health literacy. They're less likely to ask questions about their health. And so if questions are closed, things like do you understand, that require a yes or no response, are not going to yield the sort of insight that you would need as a medical provider to really assess whether or not that patient understands what you're telling them. Asking an open-ended question such as, tell me how you would take this medication every day, or explain to me what your symptoms are, gives the patient not only autonomy in their pursuit of medical care, but also an opportunity to express any discomfort or confusion openly and freely. Sometimes closed questions insinuate that the patient is supposed to understand, and so naturally, of course, they'd say, yes, I totally get it, knowing that they maybe can't actually understand the instructions, or that the words that were used in the conversation was at a level that was a bit too hard to understand, to put it plainly. It's also critical that patients are encouraged to ask questions that really encourage them to participate in the process. Patients who don't ask questions at all might feel like the decisions are being made for them. And again, if they're coming from a marginalized community, they might experience some level of trauma or triggering in that way. So it is really important that they can ask questions and make decisions. Of course, they don't necessarily have the medical expertise to make every call on their own, and you are there to support and treat them. However, if there are options available, they should be informed of all the options to the best of their ability so that they can make these decisions on their own. And this all plays into motivational interviewing as a tool to encourage better self-maintenance of health. Part of the reason why health literacy is so pertinent is because it encourages patients to engage in preventative care and to take care of themselves when they're not in a doctor's office, so that they might not need the next level of medication or surgery or what have you. And so if they feel like they can express any concern or any question, they also might feel comfortable with the information that's being provided, enough that they can apply it to their day-to-day life. So that is something that would be considered to be a best practice, engaging in motivational interviewing. And there are several trainings available for medical providers who are interested in learning more about how they can apply that to their practice. So now we will sort of talk through a group exercise that you could do with other providers at your practice. This healthcare scenario will kind of give us more insight into what patients with poor health literacy go through when they attempt to access care. And the ultimate goal of this is to help us better understand where the barriers lie, as well as how they hinder the healthcare system as a whole. So in order to engage in this small group activity, I would suggest that you provide name tags for each participant, a script of the scenario to each group, and each group should be comprised of 5 participants. So this can be conducted with a large group, just break them down into small groups of 5, and the activity as a whole should take no more than 15 minutes. And 15 minutes because in a plain language scenario, we should be able to explain what's going on as clearly and concisely as possible. So the first step is to assign each medical provider with a role. So one person would be the medical assistant, another would be the nurse, one would be the physician, someone could be a pharmacist, and then someone would be the patient. And then the scenario should be read as a group, and then everyone responds to the discussion questions, and there are specific questions for each role. So here's the scenario. A 45-year-old male patient named Abraham comes to your practice for medical care. He immigrated to California from Ethiopia when he was 15. He is an advanced English as a second language speaker, but is not fluent in English yet. His first language is Amharic. He currently works as a cashier at a pharmacy. He is also a Jehovah's Witness. Abraham navigates 4 interactions during his medical care. He first struggles to understand medical jargon on his intake forms and does not ask the medical assistant for help, though she notices his forms are incomplete. He then has his blood pressure taken, as well as his temperature, by the nurse, who then rattles off his scores accordingly, but she doesn't explain to him whether or not the scores are good or bad. The medical provider briefly talks to Abraham before prescribing 2 vastly different medications, and like I mentioned before, Abraham is a Jehovah's Witness and was concerned about the medicine and the medical care that he was being prescribed, but his provider sort of brushed him off and suggested that he discuss this with the pharmacist. This also may have been a result of Abraham having disclosed that he works at a pharmacy, the provider might have suggested that he would have a good working relationship with pharmacists and get more information that way. The pharmacist then reviews the prescriptions with Abraham, but doesn't really take the time to make sure that his guidance was understood or really even address his religious concerns. And so the discussion questions are as follows. What are your initial reactions to Abraham's experiences? What cultural barriers to health literacy impacted Abraham's experience? What guidance would you give to your assigned healthcare worker to improve Abraham's care? And after some discussion and careful consideration of everything involved, the goal is that the healthcare personnel in the room will recognize that health literacy is a group effort and begins once the patient seeks care. So as soon as the patient enters the medical space, from the very first form that they fill out, health literacy and plain language must be used. If they're aware ahead of time that this patient is an ESL speaker, a translator should be available, or a translation service at best, or at the very least. And if there are any sort of hesitations on behalf of the patient who might not be comfortable speaking up, it's our duty as medical providers, as healthcare professionals, to at least ask questions and inquire, oh, I noticed you haven't completed this form. Do you happen to need assistance? Or rather, hi, I noticed you didn't answer a question about your family history. Do you mind if I ask about your family history? Using plain language, even if the form isn't written in that way. And overall, this is just about reprioritizing patient care. Abraham was pretty much rushed along the whole time, and that's what a lot of patients experienced. And so kind of a reminder that it's important to take time with each patient to really address all of their needs. This is also an opportunity to brainstorm new ideas for improving health literacy efforts and respective practices. And after this is done, we would like to distribute a post-survey to collect suggested improvements and related changes made at each practice to see if this exercise was beneficial for that work group. And for further reading on the suggestions that I made, you can refer to any of these references. Thank you so much for your time and attention today, and I hope you are able to apply more plain language and health literacy principles to your day-to-day work.